Alcohol use during pregnancy can cause a multitude of health complications for the mother and her developing fetus. Despite public health efforts to increase awareness of the risks associated with drinking during pregnancy, a significant proportion of pregnancies are alcohol exposed. In this video, learn about the potential effects of alcohol-exposed pregnancies, how they impact Native American and tribal communities, and the work that Healthy Start staff is doing to reduce them.
Fetal alcohol syndrome it's actually part of a whole spectrum of disabilities caused by prenatal alcohol exposure, so a woman drinking during pregnancy.
Fetal alcohol spectrum disorders, or FASDs, encompass the range of conditions that can occur in a person whose mother drank alcohol during pregnancy. These conditions can impact a person's physical and mental well-being, behavior, and learning ability. Often, a person with an FASD experiences a combination of these effects. Different terms are used to describe fetal alcohol spectrum disorders, or FASDs, and they depend on a person's symptoms. The Centers for Disease Control and Prevention defines 4 types of FASDs: neurobehavioral disorder associated with prenatal alcohol exposure, alcohol-related birth defects, alcohol-related neurodevelopmental disorder, and fetal alcohol syndrome. In this video, we focus primarily on fetal alcohol syndrome, or FAS. FAS is the most severe of the fetal alcohol spectrum disorders.
And so fetal alcohol syndrome is the most harmful. An individual with FAS has recognizable facial features, small stature, small head circumference, meaning their brain is affected. Oftentimes they have learning disabilities. On another end of the spectrum, the individual might not have any physical features, but they might have trouble in school or behavioral issues or just something is going on. I always want to emphasize that substance-exposed pregnancies are an issue everywhere. And so it's not by economic, background, it's not by race. I think there's been enough studies that show that FAS affects every socioeconomic class, every race. Within tribal communities, there's not a ton of data. There's been some more regional efforts to do an FAS surveillance, and so I think those are really important. But if we're looking at individual tribes, we just don't know those numbers. And so tribal communities, there's sort of anecdotal information of this is happening in our community, and we want to recognize that. There's a lot of historical trauma that I think tribal members are facing, historical loss of land, of culture, and that's passed down generation to generation. And so again, getting back to that idea of self-medicating, alcohol can play a role in that.
I tend to be of the mind that people use for a reason. People develop addictions for a reason. And one of the challenges to solving the addiction problem is, of course, addressing those issues that lead people to use to begin with. I think that we really need to understand that when people use, they are looking for something. They are trying to deal and to cope with a particular problem, and whatever that problem may be, it's different for every person. But I think that we have to realize that addiction stems from some unmet need, some unfulfilled need. In our communities, there are many. Our tribes and our state governments have struggled to find ways to deal with this, and those ways usually turn out to be the justice system. If you can incarcerate a mom, you can at least keep the baby from being exposed to substances.
The criminalization of substance use by pregnant women is not limited to tribal communities or to states with significant numbers of Native American residents. 23 states in the District of Columbia consider substance use during pregnancy to be child abuse under civil child welfare statutes, and 24 states in the District of Columbia require healthcare professionals to report suspected prenatal substance use. In 3 states, if a pregnant woman has been found using, it is grounds for civil commitment. That is, the woman may be involuntarily committed to a substance use disorder treatment program.
Yet we know The American Academy of Pediatrics, for example, says those are futile ways of dealing, that these should be dealt with as mental health issues, as an illness, as a disease.
There's a great quote from someone I used to work with that this is a priority for their community that they've set. And so I think each tribe has their own health priorities, but a lot of tribal communities recognize that prevention is essential, diagnosis is very essential, and then working with kids and adults who have FAS is so needed. I think a supportive environment always helps with reducing risky drinking. So are there people that, let's say a woman who wants to reduce their drinking, are there supports available that she can seek out to do that? Whether that's with her partner, with her family, with her community, are there cultural things that she could tap into that will help with reducing her drinking?
In South Dakota, treatment facilities are very few and far between, and so our moms might not have access to treatment, and we're looking for ways to change laws to provide treatment. So we're providing advocacy. We're providing training, we're providing education to the clients. We use the Family Spirit curriculum, which is an evidence-based, culturally appropriate curriculum that talks about healthy living, talks about the dangers of the baby. I don't think moms have a clear picture of what some of the things that they're using can do to the baby during pregnancy. So we're providing education surrounding those things.
The Alcohol and Substance Exposed Pregnancy Prevention Initiative, or ASTEP, offers training and technical assistance designed to increase your understanding of the impacts of fetal exposure to alcohol and other drugs and strengthen your capacity to engage in effective prevention and early identification activities in your community. To learn more, visit healthystartepic.org/ASTEP.